Our film tells the story of some patients from the Manchester area who were treated at Crumpsall and Whittington hospitals. It shows some of the medical and social factors affecting the condition of elderly patients and the wide range of skills needed for successful treatment. Geriatric medicine involves much more than the provision of care for the permanently sick amongst the older age group. Patients are accepted only following a request by their general practitioner, and usually are then seen at home by a senior hospital doctor. In this way, both medical and social factors can be assessed. Sometimes the general practitioner accompanies the doctor, and at times a health visitor or nurse. This old man lives alone, and advice on management has been requested. He has recently developed mild congestive heart failure. At this stage, hospital admission is not needed, but the health visitor will look into the question of extra domestic support. The hospital doctor meets the general practitioner to see an old lady who is chair-bound because of arthritis. Hers is a room with a view, a very circumscribed world. As with other specialties, the general practitioner may send his patients to the geriatric outpatient clinic. The history and full medical examination with appropriate investigations may be sufficient to guide home treatment. Drugs for the relief of pain and exercises to improve joint function are recommended in a letter to his doctor. Our next patient, Mrs. Brown, has myxedema due to reduced activity of the thyroid gland, a condition which is not uncommon in old age. She has a typical appearance with thinning hair and rather coarse features. In addition, she requires a new set of teeth. Simple measures of this sort can be of great benefit, and no one is too old for consideration. Mrs. Brown improved on replacement therapy with thyroid hormone, but she remained frail and needed to go into an old people's home. This one is run on a voluntary basis, but most homes are administered by the local authority welfare department, and many are now purpose-built. With some patients, hospital admission is clearly indicated. Mrs. Clark has had a severe stroke, causing paralysis of the left arm and leg. We will see her progress at intervals during the remainder of the film, until she has achieved sufficient independence to return home. In the early stages, expert nursing care with attention to pressure areas is of the greatest importance. Investigations are carried out to determine the cause of her stroke. Amongst these, she has a lumbar puncture. After preparation, a specimen of the fluid cushioning the brain and spinal cord is withdrawn. In this instance, it is normal in color and under normal pressure, and microscopy and biochemical tests reveal nothing abnormal. These are Mrs. Clark's angiograms, which are special X-rays of the arteries feeding the brain. Mr. Davis had fallen on hard times. Once a very agile man, he can now barely walk. His working life had been spent in the theatre as a trick cyclist. Now he suffers from malnutrition. In hospital he improved with a full mixed diet. This is the sort of diet he had been eating, which consisted mainly of bread and butter and tea. Old people should eat fruit, meat, cheese, eggs, and milk. Vitamin supplements are often useful. They can be given by mouth or, in selected cases, by injection. Mr. Davis, like many old people, had poor eyesight and needed glasses for reading. Mr. Davis, almost recovered, sits playing draughts with another patient, Mr. Murray. Mr. Murray was admitted in a very debilitated condition with a leg ulcer. As with all patients, he is having a routine full medical examination. Examination here of the heart and of the lungs. The blood pressure is being taken. Examination revealed multiple pathology. He had severe anemia, coronary artery disease, and mild bronchitis, as well as the leg ulcer. Blood examination confirmed the presence of anemia. The type of anemia was determined by examination of the bone marrow. A small blood transfusion was well tolerated. An electrocardiogram is taken to confirm the diagnosis of coronary artery disease. Mr. Murray has improved to the stage where he is up and dressed. He wears a special felt boot to protect the ulcerated leg. The ulcer is continuing to heal, and he is now able to walk with assistance down the ward. Mr. McGregor has to spend his life in hospital because of a disease of the nervous system. He is completely paralyzed below the neck, yet he is not miserable. He enjoys a cigarette, has a lively mind, and is a reader. To give him a measure of independence, he is provided with an automatic page turner, which he operates with his chin. When a long stay in hospital is necessary, diversional therapy prevents boredom and helps to keep interested minds in disabled and diseased bodies. Very few need to spend their days confined to bed. Many activities are encouraged to make the maximum use of remaining function and to help maintain dignity. Morale is boosted by attention to appearance, hairstyling and makeup for women, and clean, smart clothes for all. Events such as birthday parties relieve the monotony of long periods in hospital. A telegram from the Queen marks the 109th birthday. The Mayor and Mayoress are in attendance. Long-stay patients may become quite isolated from the outside world, and all possible contact with the community is encouraged. Trips are greatly appreciated, such as a visit to the illuminations at Blackpool.